Hi, I'm Dr. Neal Bhatia. I'm Director of Clinical Dermatology at Therapeutics Clinical Research in San Diego, California. So with PDT, we talk about scarring, we talk about pigmentation change, we talk about photoaging, and again, for me, it's talking about the field of treatment, not just the individual lesions. So I incorporate both of those. Obviously, if surgery is the issue, then we're cutting out what we see, we're cutting out the margin, and then we're dealing with the surgical scar, which again, it can be a very good surgical scar, but many patients are afraid of them. And they need to be talked into them for some reason. I think again, talking to patients about what the potential benefits are to the treatment area, and down the road what they could be experiencing in terms of photoaging and reduction of AKs all comes into play and could have some real impact on their decision to use PDT, either as an alternative or as an adjunct to any surgical option. If PDT is an option in the office, it has to be in the algorithm mix. And patient preference for scarring, for cosmesis is important, but the definitive resolution of the tumor or the cancer in front of them has to be the priority. And again, the data we have with PDT is still very good. There are some ongoing studies with red light, with superficial basal cell. There's some others with blue light that have been proven, especially with the next generation lights that are in front of us. I think we really have a good opportunity to incorporate PDT, whether we do surgery or not, and also whether we want surface areas to be chosen that could be potentially preferable for using PDT on them. Selfishly, for any dermatologist out there who hasn't tried PDT or is concerned about it, and again has not incorporated into practice for even superficial basal cell, or even if they haven't in their office and haven't tried it for basal cell, first thing I would say is try it. Talk to the medical people from both companies that bring PDT domestically. Go to some of the meetings where PDT is on stage. Look at some of these webinars. Look at some of the articles. I would not be afraid of what photodynamic therapy can offer. The pain of surgery, I think, is a lot worse than of PDT. I think the opportunities to keep skin cancer away with PDT is significant. And I think, what I would really want them to know is that there are some good algorithms for pre-treatment, for the day of treatment, for the day after treatment, and as well as, maintaining the gains and keeping symptoms to a low. Follow some of those algorithms. And, if you have any questions, feel free to call me.